Hello viewers, welcome to Excel Health Arena. And the other method of family planning that we are going to talk about today is a permanent method of family planning. The permanent method. Permanent method, like the name implies, is not reversible. So you have to be very, very sure that that is what you want before you go ahead. You have to, in fact, when you are taking through the information, you go to the clinic, they explain to you and all that, they will still give you some time. You will go back home, you will go and think about it very, very well. You would take time to resolve within yourself that is what you want, because it is not reversible. So once it is done, it is done. That is why it takes time before such decisions are taken. But of course, there are many women that are taking up the permanent method of sterilization. In fact, men also take up permanent method of sterilization. Even though in African settings, or let me say African countries, very, very, on very rare occasions do we see men that would actually resolve in their heart to take up permanent method of family planning. Men usually, by men's makeup, by our cultural background and all that, in the African world, men find it difficult to see themselves in a situation that will make them, decide to do such a thing. They feel that when it comes to things like that, women should be sacrificial and not men. And for that reason, they expect that even if it has to be permanent method, it will be the woman that will do it, not the man. So on the average, men find it difficult to agree to do such a thing. So the permanent method of family planning, of course, can be taken up by a woman or a man. So for the man, it is a surgical procedure for both of them, permanent surgical procedure, and it is intentionally done to terminate male and female reproductive function. You want to stop the reproductive function of a man or a woman. Okay, and so for a husband and a wife, once somebody decides to do it, the other person does not need to do it. So for a couple, one of them just needs to do it, not the two of them. Okay, so it is appropriate for men, it is appropriate for women, whichever one, it's fine, and both of them are not reversible. Both of them have to go through surgical operation, even though one is milder than the other. For the men, it is faster, it is cheaper, it is milder in form compared to that of the woman. So for that, in fact, the men's own can be done under local anesthetics. So they can just infiltrate, put some local anesthesia on the scrotum and around the area where the procedure is to be done, and they will do it, and the man will not feel pain. So it's not a big surgery like that for men, but for women it's a big surgery. Even though with the advancements of technology, it has become a lot easier and simpler in that, even without opening up the woman, giving incision that would open up the woman laparoscopically, it can be done now. So they can do it through some devices that will be looking at the organs within the uterus, everything that they want to do, they will be looking at them through the screen, and of course the operation will be performed without necessarily cutting the woman open. So it makes it a lot easier, and in a situation like that, also to for kabale. So now the one for men is called vasectomy, and the one for women is called tubal ligation. Sometimes the tube is not only ligated or is not ligated. So sometimes it could be occlusion. It could be in form of occlusion. They just block. It could be in form of tying. I'm going to explain each of them as we go on along this discussion. So for men that do not want more children, it is acceptable for them to have vasectomy. We call it vasectomy, and they dissect the vas deferens and they occlude it, they block it. The vas deferens is a kind of pipe, a tube, where the sperm passes through from where the sperm is stored in the scrotum, where the sperm is produced and stored. Then by the time sperm is to be released during ejaculation, it does not, even if it is released, it does not have a way of going through and of course coming to be ejaculated, because the vas deferens, which is the passage pipe or tube, has been cut. So in a situation like that, there is no way the person will be able to impregnate a woman, even though there are still other precautions. When such a surgery is performed, it cannot be effective immediately. It cannot be effective immediately. So a man must know that when that procedure is performed, he still needs to wait for some time. I'm still going to talk about how long the man needs to wait before the man can assume that yes, he cannot impregnate a woman any longer, and so he is free to go ahead and have intercourse without protection and would not have fear of impregnating a woman. There is no interference with intercourse, because sometimes one of the fears that men have, apart from the fact that it is not reversible, is the fact that they are afraid that they may not be able to attain erection again. So it does not affect erection in any way. Okay, so if you go through, if you have vasectomy done, it does not prevent you from attaining erection. Okay, it can be done under local anesthesia, like I said, and it is just surgical contraception. It does not have to make you not to have erection again. So it is simple, it is safe, it is very effective, and it can be done, like I said, at the outpatient department, depending on the facility where you attend to have it done. So it does not have any effect on sexual activity. It does not have any effect on the semen volume, because you will still be able to ejaculate. Okay, you will still be able to ejaculate, but it will not contain sperm. That is the difference. It will not contain sperm. The fear of the fear of castration, because many people used to believe that when they talk about vasectomy is about castration. No, it is not castration. And so a man that goes through vasectomy will still attain erection and can still ejaculate. The only thing is that the semen that is ejaculated does not contain sperm. So it's, like I said, sterility or sterilization does not occur immediately. So it requires about 20 ejaculations. About 20 ejaculations before the man can assume or believe that there is no more sperm contained in the semen that he ejaculates, and so he may not be able to impregnate a woman. So it's important that you don't assume that immediately the procedure is done and it's healed up. Yes, I'm ready. Permanent sterilization. So kima fire loni asen kò kàn mí, mi ní fear pé mo lè impregnate èèyàn. It doesn't happen that way. So at least 20 ejaculations before you can assume that you will not be able to impregnate a woman, and that will take about approximately 3 months. So for about 3 months after doing the procedure, ejaculate regularly, but be sure that you may get pregnant if you don't protect yourself. So for that reason, you may impregnate a woman rather if you don't protect yourself. So for that reason, you need to use other methods in support, like condom, during this period of 3 months and for about 20 ejaculations, to be sure that you are not going to impregnate a woman. And now, in a way, even though we call it permanent method,